Hello friends, hope you are doing well. This is Dr. Iqbal Ibrahim with a new video. The topic of this video is Polycystic Ovary Syndrome or PCOS, that is PCOS. In this video, we will talk about what is PCOS, its causes, signs, symptoms, diagnosis and treatment. Let's get started. Polycystic Ovary Syndrome is a very common hormonal disorder. It is usually found in a reproductive age group females, that is females between 15 to 45 years of age. Now we will talk about its causes. Number one, genetics. Just like other diseases, it also plays an important role. If your immediate family members like mothers, sisters have PCOS, then your chances of having this disease increases. Number two, insulin resistance. When there is insulin resistance or high insulin levels, chances are high to have PCOS. Number three, hormonal imbalance. There is an imbalance of the following hormones: increased androgens, increased prolactin, increased LH or luteinizing hormone. One hormone is decreased in this case, that is FSH or follicle stimulating hormone. Now we come to the signs and symptoms. Number one, periods are irregular. Females have irregular periods and they may have no periods or heavy bleeding during their periods. Number two, weight is increased. Yes, most of the females with PCOS are seen with increased weight. Number three, due to increased levels of androgens, which is a male hormone, acne is found on face. Also, hairs are present on face, chest, and other parts of the body. Number four, skin changes. What are those? Skin becomes oily, dark patches are seen in neck and other areas of the body. That is called acanthosis nigricans. Number five, infertility. Yes, let me explain you how. During each monthly cycle or period, ovulation occurs, meaning that an egg is produced. The regular period and ovulation on time is needed for a normal pregnancy. In PCOS, where periods are irregular and ovulation does not occur on time, it may cause infertility or problems in becoming pregnant. Now we come to the diagnosis. Diagnosis is made on three important criteria. Number one, history of the patient showing irregular periods. Yes. Number two, blood test showing increased levels of androgens. That is a male hormone which is the cause of all these signs and symptoms. Number three, ultrasound showing ovaries with a small multiple cyst called polycystic ovaries. Now we will talk about the treatment. I have divided treatment into two parts. Part number A, lifestyle changes, and part number two is medication. So what are the lifestyle changes? Number one, weight reduction. Yes, it plays an important role. Not only it reduces androgen level, but it also decreases insulin level. Number two, exercise. Exercise is very important. If you don't have time for exercise, at least a walk of 20 to 30 minutes, 4 to 5 times a week is a must. It decreases blood sugar level and also improves insulin sensitivity and also helps to maintain normal hormonal levels. Number three, healthy diet. Decrease carbohydrate from your diet so insulin level remains decreased. Use more vegetables, green vegetables, nuts, fish, lentils and other healthy foods. Number four, good sleep. A good night's sleep of 7 to 8 hours is a must. Remember, a good night's sleep helps to decrease your fasting blood sugar levels and also regulates your hormonal levels. Dear friends, if you follow these important lifestyle changes, you can control your hormonal imbalance and also minimize the need of medications. Now we will talk about medicines, why and what medicines are needed. The medication that are usually needed are birth control pills or oral contraceptives. They are used in PCOS to regulate periods and also hormonal levels. Next is clomiphene citrate. If there is a problem in pregnancy, then this medicine is used, which is helpful in ovulation. The next medication is metformin or glucophage. This medicine, it is usually used to treat diabetes, but here it is used why? To improve insulin sensitivity, to regulate hormonal balance, and it also helps to decrease weight. Yes. Hope you have liked this video and it would have increased your knowledge about PCOS. Please share this video to your family and friends. Like and subscribe my channel so you get the notifications of my new videos on time. Now I would take leave. Take care of your health. See you soon in my next video. Bye.